Welcome to the Canadian Liver Foundation's LIVERight Health Forum, Ask the Expert series. This week-long health forum will present valuable information on important topics relating to liver disease and liver health. To kick off this week's sessions, we are pleased to invite Dr. Eric Yoshida. Dr. Yoshida is a highly regarded liver specialist with many accomplishments. He is a full professor at the University of British Columbia and is nationally and internationally known in the area of liver disease and liver transplantation. He is also the chair of the Canadian Liver Foundation's National and BC's Medical Advisory Committee and the chair of the LIVERight Health Forum. Today, he will be talking about chronic and acute liver failure. Please join me in welcoming Dr. Eric Yoshida and our forum host, Valeria Zaborska.
Well, thank you, Monica and Val. Val and I are wearing these masks and we're taking them off because I think it's important for everybody to appreciate that during the COVID-19 pandemic, everybody must wear personal protective equipment. Everybody must be safe. It's not known for sure, but we strongly suspect that if people with liver disease get COVID-19, their course may be more serious than somebody who doesn't have liver disease. So I would say, please wear your masks, please wash your hands, please social distance like Val and I are doing.
Thank you. Thank you for being here, Dr. Yoshida. And thank you for joining us. So our liver works 24 hours a day, 7 days a week. It processes virtually everything we eat, we drink, we breathe in, we put on our skin. In fact, it performs over 500 functions to the body. Now, there do exist over 100 forms of liver disease, and a lot of them, when left untreated, can lead to liver failure. And there are two types of liver failure, acute and chronic. So Dr. Yoshida, in terms of questions that the audience was asking, they're wondering, what is the difference between chronic and acute liver failure? What are the common causes? Who is at risk? Is age a factor? And is either of them hereditary?
Well, thank you, Val. Well, in answer to the first question, I may forget the question, so you might have to remind me. But the difference between acute and chronic liver failure is just a matter of time. Acute liver failure, somebody is perfectly healthy, and for whatever reason, they get acute hepatitis A because they went to some place, or they took too much Tylenol because they had a bad headache, and maybe there was some alcohol involved, or sometimes nobody really knows why. The liver just suddenly starts to fail. Chronic liver disease is more different. This is an insidious process that may or may not lead to cirrhosis, and may or may not put the person at risk for liver cancer. And this can go on probably undetected unless you see your family doctor for years, even decades before something happens. This can go on for 20, 30 years before you suddenly present to your local hospital in total liver failure. Commonest causes of acute liver disease, acute viral hepatitis, hepatitis A, hepatitis E. It used to be thought to be more common in some places outside of Canada, but now we know it is kind of like a worldwide phenomena. Acute hepatitis B, there's also chronic hepatitis B, but there's acute hepatitis B. Any drug you take can cause acute liver failure. Some are totally idiosyncratic, which means that it's unpredictable. It could happen in anybody, and that's something scary. The other liver acute drug hepatotoxicities can be predictable based on dose, like Tylenol or acetaminophen. We don't want to get sued by the Tylenol manufacturers, and that can be aggravated and worsened by heavy alcohol consumption. And a lot of times we simply don't know why somebody has acute liver failure. Chronic liver disease, that is more common. Hepatitis C, hepatitis B, the chronic form of hepatitis B, autoimmune liver diseases, which are rare, but they do happen. Fatty liver disease, which is not necessarily related to alcohol. In fact, in most cases, it's not. And that affects like It's thought to affect 20 to 30% of the population. So that's pretty serious. Metabolic liver disease like hemochromatosis, genetic condition, and there's also hereditary causes of liver disease. Alpha-1 antitrypsin, Wilson's disease, which is copper metabolism. The list just kind of goes on and on and on.
Okay. So following that, then, what are some symptoms that people can watch for of both acute and chronic liver failure that should ring the alarm that they should seek medical care?
Well, in most cases, your liver will be totally silent even though you have liver disease until suddenly it's about to just pack it in. And the reason for that is that your liver has tremendous reserve. In order to have symptoms, you really have to compromise your liver by at least 80 to 90%. So, you are functioning on a reserve of like 10 to 20%. It's kind of like driving your car with your gas gauge near empty. You do have a reserve, but at some point your car is going to conk out, and the same with your liver. And some of the features of liver failure, whether it's acute or chronic, you're jaundiced, like your eyes are really, really dark brown or dark yellow. That's often scary. Your mind is kind of not working well because all the ammonia and other toxic chemicals, biochemicals produced by your GI tract that your liver would normally filter out are just kind of bypassing a failed liver and going right to your brain. So it can almost seem like you have dementia, like Alzheimer's. And then you drift further into it and you could actually develop a liver coma. You can develop huge amounts of fluid accumulating in your abdomen, such that it looks like you're pregnant with triplets. All these kind of bad things can happen. Your kidneys can fail, et cetera, et cetera.
And so if any of these symptoms happen and you present to a doctor or to the hospital, what are the steps to treat acute and chronic liver failure, and what are the survival rates like?
Well, the survival rates once you present with acute and chronic liver failure, it all depends on the degree, right? If you're in hospital, you have significant jaundice, you have stomach ascites, you have muscle wasting because this has been going on, you're totally confused, drifting in and out of a coma. Your mortality is very, very high. You need a liver transplant, otherwise you're going to die. And then people with early liver disease, it can be, well, the long-term mortality might be high, but you can be saved by medicine depending on what the cause is. Like hepatitis B can be treated, autoimmune liver disease can be treated, those kind of things. If you drink too much alcohol, maybe you should stop drinking. Well, actually, not maybe you should stop drinking. You gotta stop drinking. And then you might need a liver transplant. So there's so many variables, but the thing is, you need to be picked up early, and you really want to be diagnosed with your liver disease before you start showing signs of liver failure so that something can be done about it. Even if it means stop drinking alcohol, even if it means if you have fatty liver disease, start working on a healthy diet and exercising.
Okay, thank you. So the next question is a bit different. So member of the audience is asking if viral hepatitis can cause liver failure. And they're wondering if you can talk about the difference between some of the more common hepatitis. So B, C, maybe A.
Yes. Thank you, Val. Well, as I mentioned before, acute hepatitis A, acute hepatitis B, acute hepatitis E, yeah, those can cause acute liver disease and knock your liver off. There's even common diseases that most of us have been exposed to in childhood, like parvovirus B19, that rarely can knock your liver off acutely. But the thing is that most of these rarely result in death. You can usually rescue by a liver transplant, or you will recover, although you may be very, very sick. Other diseases like chronic hepatitis B that you might get at birth from your mother, which is how most people in the world get hepatitis B, or chronic hepatitis C, those viruses are insidious. Easily you're born with hepatitis B. By the time you need a transplant, you're probably in your 50s or maybe 60s, and you have cirrhosis. And so that's the lifespan of the disease, the viral infection. And the whole point is to we can deal with these. We can suppress your hepatitis B such that you can live to 100 and be happy. We can cure you of your hepatitis C. You just got to get diagnosed like relatively soon. And so that's why it's important to get picked up before bad things happen. And that's about the main things for viral hepatitis.
Okay. And are there vaccines for any of these?
Hepatitis B, hepatitis A, yes, there's definitely a protective vaccine. I think everybody in the entire world should be vaccinated against hepatitis B and hepatitis A, and the sooner the better. Hepatitis B, you should be vaccinated almost at birth. In BC, there's a policy that all newborns get hepatitis B vaccination. Other parts of Canada, I believe, they wait until they're in grade 6 or something, which it's better late than never, but ideally you want that probably at birth. Hepatitis A is kind of elective, but I would recommend that everybody get vaccinated against hepatitis A at the same time. Simple vaccination, you can prevent a long-term misery, and you can save healthcare dollars at the same time. So I think it's very effective.
Great, thank you. So the next question, elaborating a little bit on hepatitis B. So there is a known link between Hep B and hepatocellular carcinoma or liver cancer. So this member of the audience is asking how frequently individuals with Hep B need to be screened for liver cancer.
Oh, that's actually a great question. I think we do have another speaker that's going to talk about liver cancer, which we call hepatocellular carcinoma. But let me just say that cirrhosis of any cause can cause hepatocellular carcinoma, also known as liver cancer. Hepatitis B is a bit interesting because you don't need cirrhosis to get liver cancer. If you have a family history of hepatitis B, you probably should get screening ultrasounds every 6 months. I have seen young women as young as mid-20s get liver cancer and they had hepatitis B, and yet they did not have cirrhosis. The general guidelines are that men at the age of 40 and over with hepatitis B, women at the age of 50 and over with hepatitis B should get an abdominal ultrasound every 6 months, and your family doctor might choose to also add an alpha-fetoprotein blood test. The problem, in my opinion, with alpha-fetoprotein is that by the time it's really elevated, you really have an advanced disease, but still it's good to have a baseline. Anybody of African descent should get an ultrasound as soon as you're diagnosed, because nobody knows why, but in people of African background, liver cancer from hepatitis B can happen at a shockingly early age, teenage, early 20s, and it can be extremely aggressive. So in that population, get an ultrasound every 6 months as soon as you are diagnosed.
Okay, thank you. So you mentioned cirrhosis a couple of times throughout the talk. So we're wondering, how many stages are there in cirrhosis, and what does each stage mean?
Well, there's only 2 kinds of cirrhosis, just like there's 2 kinds of being pregnant. You're either pregnant or you're not. In cirrhosis, you either have it or you don't. And if you do have it, you are either compensated, which means that you're feeling well and you don't even know you have it, or you're in liver failure and you are by definition decompensated. So there's a lot of people walking around the streets, in the malls, in society, going to the movies. Well, actually, don't go to the movies now, but you know what I mean, who may have cirrhosis, early cirrhosis, and they don't even know it, right? And then there's those who have advanced liver disease, present to their hospital with what turns out to be liver failure, and they've had cirrhosis for years and they didn't even know it. So there's 2 kinds, compensated and decompensated. It's always better to be compensated.
Okay. And what is the treatment for decompensated cirrhosis?
Liver transplantation is the only thing that will ultimately cure you and bring you back to a state of having a normal liver. Everything else that the doctors do, like treating the fluid in your belly, which we call ascites, treating your hepatic encephalopathy, which is the confusion. These are all kind of things to temporize the situation. But basically, the only ultimate treatment for end-stage decompensated cirrhosis is a life-saving liver transplant.
This next question is very specific from somebody. So this person says, I'm 63 and I've had cirrhosis since 2015, but I have been sober for 5 years. Is loss of short-term memory and balance because of liver disease spreading to my brain?
That's an interesting question. Well, first of all, if you have early cirrhosis and you treat the underlying liver disease, whether it's not drinking alcohol, whether it's improving your fatty liver disease, whether it's treating your viral hepatitis or treating your autoimmune liver disease or treating your metabolic liver disease, it may entirely stabilize, may never progress, or may even actually reverse if it's caught early. In this case, it's without really seeing the patient, without really examining the patient, without doing tests, it's hard to say whether this is actually hepatic encephalopathy or the confusion from liver disease, or whether it's something else like a degenerative condition like Alzheimer's, or if somebody had a lot of trauma to the brain, whether this is chronic traumatic encephalopathy, which is also becoming more and more common. Mm-hmm. So I would say, see your doctor, just get a thorough workout or workup.
Okay, thank you. The next question is, I've heard the liver can regenerate. How can I help my liver regenerate?
You can help your liver regenerate by don't doing anything bad to your liver. So don't drink any alcohol, avoid toxins, eat a healthy diet, and exercise. The regeneration, yes, the liver cells can regenerate, but if you have acute liver failure, your liver can regenerate completely, so you don't have any sequelae of that. You may not even have any scarring, or if you do, it may get better. But if this is an ongoing process that is unchecked for decades, yes, your liver cells can regenerate, but you are developing scar tissue. Scar tissue is being laid down steadily, and at the end, you get cirrhosis. That's when your liver is completely scarred up, the architecture is totally deranged, and your liver then starts to shrink because scar tissue shrinks with time, and your liver shrinks with it. So a lot depends.
Okay. What about, this is an interesting one. What effects does CBD oil have on the liver for someone who's living with cirrhosis?
None that I'm aware of. It's better than alcohol, so I have no objections, but it's awaiting further research, but I'm totally unaware of any bad effects on liver disease from CBD oil.
Also, interesting question. How do you talk to children and handle liver disease in a family when a parent is diagnosed? Do you have any advice?
That is an interesting question, and this is where they don't train you in medical school or through your postgraduate training for this, and it is the art of being the physician, the art of being a total humanitarian, the art of being a communicator. And I think that you have to talk to the patient and their families as you would want to be talked to. You talk to them with kindness, you address their concerns, you don't minimize the seriousness, but at the same time, you don't want to really be scary. And you offer support because there will be tears.
That's very good advice.
Thank you.
Okay. This one is, I have experienced doctors who downplay my condition. What should I do, and when is it acceptable to get a second opinion?
Well, there's two reasons why doctors may downplay the condition. One is that it's not, it's mild, and therefore they want to move on to bigger and more important things, like the fact that maybe your cholesterol is super high, maybe you have coronary heart disease and are at risk of a heart attack, or maybe your kidneys aren't working or something like that. The other is that maybe they're not particularly knowledgeable about the area. Like, to be honest with you, it's like, what do I know about orthopedic surgery? Nothing. So, like when somebody asks me about their fractured ankle that's not healing well, and they say, well, what do you think, doc? I go, well, I don't really know what to think. So I have to downplay that because I don't know anything about fractured ankles. That could be it too. I think the thing is for your family doctor, just ask them in a professional manner or as in the normal social discourse, not be too aggressive, but just say, you are concerned. What about your liver disease? Do you think you have to be seen by a specialist? I think those are honest questions to ask.
Thank you. This one is, I have autoimmune hepatitis with a lot of fatigue. Why is fatigue associated with it, and how come exercise is so important to manage it?
That's a difficult question because, a lot of patients with any kind of liver disease do have fatigue, but other patients do not have any symptoms. I think that exercise, if somebody's deconditioned, they will be fatigued. And sometimes fatigue is simply a result of being deconditioned. Exercise helps a lot of things, and there's a training effect with exercise, so that the more exercise you do, the more stamina you build up, and the less fatigue you actually feel. I personally feel fatigued if I don't exercise, so it could be something like that.
Okay. Now for the last question, they're asking, how much does it cost to treat liver disease, and what is the burden of liver disease in the community as it stands now?
Well, that is a very good question. I mean, to the individual, it depends on what kind of liver disease you have. The treatment for hepatitis C, those drugs are they're very effective, but they are very expensive. But fortunately, the governments will not pay for them. That wasn't the case a few years ago, but I'll give them credit. They stepped to the plate and they said, okay, we're going to pay for these super expensive drugs so everybody has access. Same with a lot of drugs. The other costs that we don't see, the need for nursing care at home, the need for family to take time off work, those are the hidden costs we don't see. In general, though, liver disease can be expensive to the entire healthcare economy. It results in a lot of people being in hospital, occupying ICU beds. Liver transplantation is a very expensive process, both the transplant surgery and also the years that people have to be on chronic anti-rejection medications. If there's a complication of the transplant, someone needs a second transplant, they have a lot of complications, they are in hospital a long time. It is, it's not unheard of to basically rack up healthcare expenditures of $1 million or so. So it can be very expensive. And then you look at the other things that are avoidable. It seems that every single week that we're on call for liver transplantation, every other day or every third day, we get a request from some other hospital in British Columbia asking about whether a patient who is really in big trouble, really sick, can be transferred to the Vancouver General Hospital. And when you consider the cost of hospitalization per day on a ward bed is several $1,000s. ICU bed, even more than that. And it all mounts up. And unfortunately, for society, a lot of these could be avoidable. We get a lot of calls requesting transfers for patients with alcoholic liver disease, and sometimes they're very young people, but it could have been avoided. It could have been totally avoided. So it is an expensive process for the healthcare system. It's expensive to the individual. It's expensive to their families, and that's why it's so important.
Absolutely. Well, thank you so much. That is the end of our questions. And it sounds like, to summarize, try to get vaccinated and be healthy in general. And if you're ever worried about anything, see your doctor. And wear your mask during COVID.
Wear your mask. Thank you.